Bismillahirrahmanirrahim. Assalamu alaikum. In this video I'm going to show you how to apply shockwave therapy for knee pain, especially knee osteoarthritis. Currently I'm using this Jinha shockwave therapy machine, which is model as HL3621. It is a Chinese variant and it is a very low cost device. Now first things first, we need to understand how the shockwave therapy works. For this you can watch my other videos and you can easily understand that what is the working principle of shockwave therapy. We have to set a few parameters. For example, we need to understand and remember that these parameters are responsible for the changes that we want. The first parameter is number of shocks. For knee osteoarthritis and knee pain, people have suggested, based on the research findings, various articles advocated that a total number of shocks per session should be at least 2000. Secondly, we need to find the right frequency and the right power or the pressure. The frequency should be set to 8 and the power for this unit should be set to 10. So it is very simple. If you can see, when I press F, now F means frequency, it is at 7, I can keep it to 8, and when I press P, right now it's at 12, so I can keep it to 10. Now the frequency of 8 and power of 10 is set, and now we need to choose the head. Always start working with the largest head available, because this will be more comfortable for the patient. You can easily remove this head by turning it to counterclockwise. Here you can see this is the largest of all, and once your patient is becoming more tolerable to these, then you can switch to the smaller ones. The heads are concave and convex, so let's keep it simple. You can choose the head surface or you can choose the head style depending upon the area that you are treating. So they should be in maximum contact with each other. So for this head, I can show you that this is a convex head. Let's try to see the other heads as well. This is also a convex head, but the size is less, 15 millimeter. Now this head is concave. You can see this is a concave head. Okay, you can clearly see this is a concave head, and this is also 15 millimeter, concave 15, while this head is convex, it is called 35, and this is also convex and it is 15. The other heads are similar to this. This is 5 millimeters head and it is convex head. Similarly, you can choose the other head, which is 20 millimeter and concave head. So concave head is for concave surfaces that are reciprocally curved, and convex heads are for those surfaces that are tolerable to the high pressures. Once you have selected all these parameters, then you can treat your patients accordingly. Now it is important to understand and remember that we must apply ultrasound gel or aquasonic gel before we start our treatment, because this gel is very important. It helps to convey or conduct the shock waves to the patient's body. So let me bring the ultrasound gel and show you how we apply it, and Lastly, I want to show you that what is the purpose of this silicone sleeve. This silicone sleeve is for protection purposes, that your patients, they will be protected of all the contaminants and everything, and these are easily washable. You can wash them, clean them, and they are very easy to use. So there are no chances of contamination or things like that. So don't use your Shockwave therapy machine heads without these sleeves. And now I'm attaching it again, so you can use the clockwise movement and make sure that it's tight maximally. Why? Because if it is loose, there are chances that you are going to break the crystal. Now, or sometime it is also called as the bullet. Now this is the on off switch. As soon as I press this on button, the machine will start working. You must have a stopwatch with you, and for this, for knee pain, you have to apply 2000 shocks, and if you keep the frequency 8, then it means that you have to treat for at least 250 seconds, which means 4 minutes and 10 seconds to any particular site. You should treat your patients 3 times in a month. So that makes about 1 session after every 10 days. During the session, your patients can complain of pain sometime and irritation or even hyperemia or redness, but that is a completely normal phenomena. So don't worry about that, and let's try to show you the exact spots where we can apply the shockwave. Now I brought the ultrasound gel with me. You have to apply the gel directly onto the head. Here you can see I have applied the aquasonic gel. This is simply Inco scan gel. It's made in Canada, and you can use any gel that is water based. And then let's start applying the shockwave to the sites. Okay, you can see I've applied the gel, and now I'm placing my knee in extended position, and this is the medial side and that is the lateral side. So you can apply the shockwave onto the medial side, onto the lateral side, anterior side, as well as onto the posterior side. Of course, for posterior side you need to make your patient into prone lying position, and then you can apply the shockwave. So let's start applying the shockwaves. So you can see I am applying the shockwave directly onto the medial part of the knee. I can feel the pain, I can still feel the intensity. You can move it, and similarly you can keep it to the front as well as onto the lateral side. Of course, it can be a bit painful, so if your patient is not able to tolerate it, you can decrease the pressure. So now you can see, as soon as I started to decrease the pressure, it's becoming more tolerable for me. Thank you very much for watching. If you have any questions, do let me know.